Hi everyone, welcome back to my channel. So I'm doing kind of a little test video on a new phone, just to see what it sounds like, but also to kind of give you guys a little bit more of an update on what's been going on with me. So if you saw my previous video where I talked about infections, an infection that I had, and a couple of the antibiotics that I had to take. I didn't elaborate any more on that because it would just take a whole other video to make. And I also kind of debated whether I wanted to make a video on fluoroquinolone toxicity because there are lots of videos. I'm sure there's lots of videos on YouTube talking about fluoroquinolone toxicity and what it is, and I guess how you can mitigate the effects of fluoroquinolone toxicity and that kind of thing. I guess the best thing for me to do is make a video on how it has affected me, and the challenges that it has presented given my health issues and given things that have been going on with me in the past year. So I will have to make a separate video probably discussing the infection that I had. It is kind of, I want to say that it's kind of personal because it was a vaginal infection. It wasn't an STD or anything like that. There is a little bit of controversy over whether that type of bacteria is an STD or not. But from what I was told, it is not. But I will probably have to make another video. I'm going to have to research it actually because I really am not very familiar with that type of infection. But when I was diagnosed with this, it took me about 3 different urgent cares until I finally got diagnosed, or until someone finally found this infection and or thought to test for it. And it has to be done with a very sensitive, I think it's like a PCR test or something like that, because it doesn't pick up on other tests. I had an EV test done. If you guys know what an EV test is, it's like a vaginal microbiome test that you can just purchase. It's mailed to your house. You do the swab and you mail it back. And they do the sequencing of all the bacteria that you have in your vaginal microbiome. And I did that test and the ureaplasma didn't come up. So it's going to be kind of a whole video on just that. But I do have to research it. I do want that video to be more thorough, so that it kind of looks like I know what I'm talking about, or at least I kind of have a better idea, because I think it's very, very important, because that seems to be a very often overlooked infection for women, and it's and there are serious consequences because of that, and I've seen a lot of that. I've seen a lot of women sharing their stories online, and it was just an infection that just kept getting overlooked and overlooked and overlooked, and unfortunately some people suffer for a very long time without treatment. So the third urgent care that I went to finally found that infection, and they also did something called an antibiogram. An antibiogram is a test that tests the resistance genes of that bacteria. So not only did it detect the bacteria, it also tested the bacteria to see what whether it had resistance to different types of antibiotics. So this is a very, very thorough test. You're not going to get this test done just anywhere. This is a test that, I mean, I don't know which lab they sent this to. You know, it was an urgent care. It was the third urgent care that I went to. And they, I guess, had or knew where to send this out for testing. Microgen, there's a lab called Microgen DX. They also do that kind of testing, but you have to pay out of pocket for that test. And I did do that test afterwards, and it cost quite a bit. And I kind of felt like it was a pointless test because I had already had a very similar test done. So when I got the results back of this antibiogram, it showed that the ureaplasma infection that I had, first of all, it showed that it was positive, and it was highly positive. I had ureaplasma parvum, ureaplasma ureolyticum, and I think some form of BV as well. Those were the 3 bacteria that were detected, and that was basically what was detected in this test. And then they did the antibiogram. So for the ureaplasma, they test. There's 3 drugs that are effective for this. It's doxycycline, or the tetracyclines. Then I think macrolides, which are azithromycin. Don't quote me on this. I have no idea, but azithromycin, clarithromycin, and then fluoroquinolones. Basically, what my antibiogram showed was that the fluoroquinolones were the most effective. That this bacteria did not have any resistant genes for fluoroquinolone antibiotics. So basically, any of the fluoroquinolones were going to kill this bacteria effectively. They were going to have some kind of activity against this bacteria. It did have resistance genes, possible resistance to the tetracyclines and the other ones. So azithromycin and doxycycline, which are the first line of treatment for this type of bacteria, could possibly, this bacteria could possibly be resistant to those. So that left me with one effective antibiotic, one antibiotic that would be guaranteed 100% to kill this bacteria, and that was a fluoroquinolone, anything in the fluoroquinolone class. So I was vaguely familiar with fluoroquinolone antibiotics due to my my experience with Lyme disease. Fluoroquinolones are avoided with Lyme disease because fluoroquinolones can have some very, very serious side effects. I was vaguely familiar with it, and fortunately was never prescribed a fluoroquinolone in the past, so I had no experience with that. But I know that if I would have gotten prescribed a fluoroquinolone, I would have been aware on some level of that drug class and what they do and what kinds of harm. That I wasn't sure exactly what they did to people, but I knew that there was some kind of controversy over these drugs, over this specific type of antibiotic. Once they prescribed me that, I did get prescribed that one first, and then I was aware of what it could do, so I requested a different antibiotic to try first from one of the other classes, knowing that there could be possible resistance, but also just trying to be on the safe side. I kept my fingers crossed that it would work and that I wouldn't have to use the other antibiotic. Now, what happens, I did end up taking both antibiotics because I spoke to a gynecologist that was familiar with these types of infections. And she basically told me that these types of infections typically require dual antibiotic treatment. So that means I needed 2 types of antibiotics from 2 different classes to treat it. I knew that one of them was going to have to be a fluoroquinolone because if you guys have been watching my videos from this past year, I've had repeated sinus infections. I'm on my 4th sinus infection in the 12-month span, and I've been taking azithromycin for those infections. Now, the fact that I've been taking azithromycin repeatedly throughout the year, and I still came up positive for this infection, tells me that this infection was likely resistant to that type of antibiotic. And so I basically figured there's no point in even trying that class of antibiotic because I've been taking it multiple times this year, and when I came back positive for this other infection, it was highly positive. I had a tremendous bacterial load. It was ridiculous. So there was no way, there's no way that I accrued that bacterial load within this year. I'm pretty sure this has been going on for several years, and so, I was like, there's no point. I'm gonna have to do a fluoroquinolone. So I did 10 days of doxycycline and then 5 days. 5 days over the course of 7 days because I was afraid of taking ciprofloxacin. Now, I did speak to a specialist that specializes in fluoroquinolone toxicity. Not a specialist, he's a doctor. I'm not going to mention his name. I know I talked about this on another video, but I did consult with him, and he basically told me don't take it. I knew because of my other health issues that I was at very high risk of getting fluoroquinolone toxicity, which is basically oxidative stress. If you have Lyme disease, if you have long COVID, if you have any of those, ME/CFS, you're basically dealing with a lot of oxidative stress in your body, and it's the same thing that happens with fluoroquinolone toxicity. It's a lot of oxidative stress. So I kind of just want to fast forward. I did do the medication. I took the medication, and also too, the more you do, so the more combinations of drugs you do with a fluoroquinolone, the higher your chances are of getting floxed, which means getting fluoroquinolone toxicity. So I did doxycycline first, and then that increased my chances of getting floxed. If you take steroids at the same time, it increases your chances of getting floxed. If you take Advil or ibuprofen or any kind of non-steroidal anti-inflammatory drug at the same time, it increases your chances of getting floxed. If you take them afterwards, after completing your fluoroquinolone antibiotic, it increases your chances of getting floxed. So you're kind of screwed in a way, because no matter what you do, you're either gonna have to be very, very careful after you complete the treatment, or very careful during the treatment, or just, I don't know, figure out another alternative. It's really, really tough. You're kind of stuck between a rock and a hard place. I had this infection for over a month. It was driving me crazy. I didn't know what else I was going to do, and I basically just had to bite the bullet and do it. And I did the 10 days of doxycycline and the Cipro, and fingers crossed. I did come back negative for, twice. These infections can come back. I'm going to do whatever I can to keep them from coming back. But for the time being, right now, I'm just working on mitigating the effects of the Cipro. Did I get floxed? Yes, I got mildly. I can't even say mildly, because technically I'm already floxed from Lyme disease and all those other issues. I already have long-standing issues from that. But I did get floxed. It did make my symptoms worse, particularly my knees. My knees took the biggest hit, and my my light sensitivity a little bit. Like, I'm more sensitive to the sun, which is, I'm usually sensitive to like fluorescent lights or certain types of artificial lighting, LEDs, some LED screens, fluorescent lighting 100%, I'm very sensitive to. But now I can see that I'm more sensitive to the sun. It just seems brighter to me. It doesn't hurt, but it just seems brighter. Like, I really do need my sunglasses when I'm out in the natural sunlight, especially if it's very sunny. The other thing that I am discovering in the last couple of weeks is that my histamine intolerance has gotten worse, and I'm gonna have to do a video on to be honest, I didn't know much about histamine intolerance. I started developing histamine intolerance back in 2019, around the same time as SIBO. SIBO and histamine intolerance go hand in hand, but these drugs that I took, these antibiotics, the doxycycline and the Cipro, they can also be used to treat SIBO. I thought that if I killed off, and that was one of the reasons why I decided to start with doxycycline, because I know it can also be used for SIBO. So I thought, hey, let's kill two birds with one stone, if possible, right? I do think I killed off a lot of bacteria in the intestines. I don't think it helped my histamine issues. My histamine issues have actually gotten worse. So now I'm having more food intolerance, more issues, in that department, more persistent nausea, bloating, stuff like that. And, it's kind of disappointing, because I was sort of hoping, and this could very well be from the Cipro, not from the doxycycline, because I did notice the doxycycline kind of helped with some of the symptoms, particularly like bloating, and the bloating and sort of my appetite. Like, I felt like my appetite got a little bit better with the doxycycline. My tummy was flatter, things like that. So it could be the Cipro. The Cipro was kind of like overkill, but I needed the Cipro to kill the other infection. So it might have just killed off a lot of good bacteria, or again, the oxidative stress just really kind of threw things a little bit through the roof. So, I knew and I anticipated a lot of these issues. I also developed some acne on my back, a flare up of acne and all of that. I did anticipate this. I did prepare for it. I made a lot of mistakes, because some supplements that I was taking were actually not good for me. They actually made histamine issues worse. So I stopped those. So things have gotten worse. The knee issues. So basically, what they recommend when you have fluoroquinolone toxicity is basically to start taking antioxidants. So we're talking about glutathione, CoQ10. I think like maybe even resveratrol, like antioxidant types of supplements. Magnesium is a big one, just to offset to mitigate the effects of the fluoroquinolone. Um, so it has helped. The CoQ10 in particular, CoQ10 and magnesium do seem to be a big help. I have something in my eye. They seem to be a big help. Um, but obviously, magnesium can loosen your stools, which I already had after 2 weeks of antibiotics. And then, I think a lot of it is just, sometimes it just takes time. And that's another thing that I was reading, is that it just takes time for a lot of the fluoroquinolone side effects to just kind of go away. You can help it out. You can take antioxidants. You can take magnesium. But sometimes it just takes time. It takes time for them to fade away and to sort of resolve. And that's one of the big things that I've seen, is that it's just going to take time. I was told to avoid exercise for 6 months after taking the fluoroquinolone. Haven't, I've still been trying to at least go for walks or do some stretches. But for the month of February, I did take it easy because it was kind of a long month. I had a lot to do. Um, there's, I'm not, I've seen other people's experiences, and granted, you can get worse. Sometimes you're not even that bad after the antibiotic, and you can get worse a few months down the line. My knees have been better. I was also getting joint pain in my arms. That seems a lot better. So I'm hoping that those things continue to improve and eventually just resolve, even with the supplementation that I'm taking. But the gut issues are a serious problem. They're probably a bigger problem than anything else, to be honest. And right now, I'm kind of in the midst of, I'm sort of realizing that my histamine issues have gotten worse. Um, I kind of thought at first that it was something that I was taking, and it was. I was taking some supplements that were provoking my histamine issues, but I am starting to see that I am just more histamine intolerant now. My histamine issue has gotten worse. So I don't think SIBO, you can have SIBO without histamine intolerance. You can have histamine intolerance without SIBO, is what I've been reading. So a lot of people do believe that they go hand in hand, and if you kill down the SIBO, it gets rid of the histamine intolerance. I don't think that's true, or else I wouldn't be worse. I actually would be better when it comes to the histamines, because I do think I killed off a lot of the bacteria, a lot of the overgrowth, especially because I've done multiple rounds of antibiotics. I've done 2 rounds of azithromycin, a round of amoxicillin, doxycycline for 10 days, plus the five plus days of the Cipro. So, you know, even though those drugs aren't specific to SIBO, I think doxycycline can be used for SIBO, but azithromycin and Cipro are not specific to SIBO. They're still going to kill off a lot of that overgrowth, as well as some other problematic bacteria that can contribute to SIBO and bowel issues. Now, that being said, my histamine issues appear to be worse. So I do think that it also killed off some beneficial bacteria. It also will affect the lining of your intestines. My histamine issues were already acting up prior to this treatment. As I told you guys in another video, I've mentioned it before. I had 2 colonics over the summer when I went to Mexico, and that triggered my hair loss again, and that's a histamine related issue. And then the Suprep for the colonoscopy also triggered more hair loss, which I believe, again, is tied to the histamine. So the antibiotics just basically took me over the edge. Antibiotics, oxidative stress, gut issues. My gut has still not normalized the way that it was prior to these antibiotics, which my bowel movements were the most normal that they had been in, in a long time. TMI, I know this is TMI, but I just want you guys to be aware about fluoroquinolone stuff. If you're prescribed moxifloxacin, ciprofloxacin, anything that ends in the CIN, those are fluoroquinolones. ask your doctor if there's any other alternative, if there's anything else that you can take besides that class of drugs, because it will definitely have, it can definitely have some serious consequences. Not just GI issues, but there's people that end up in wheelchairs, they end up with a lot of body pain, lots of psychiatric symptoms, depression, anxiety, you know, histamine issues. There's a lot that can happen, and I don't want to scare people. It doesn't happen to everybody. It happens to, again, the minority of people, but it is, there can be other alternative antibiotics that you can use. Now, with that being said, I am on my 4th sinus infection of the year. So this is going to be a to be continued video. I'm on my 4th sinus infection of the year. I've been dealing with it for a couple weeks now, and because of the fluoroquinolone, I was highly advised to avoid a lot of things. I mentioned some of those things a little while ago: Advil, steroids, etc., etc. Now, one of the other things to avoid is, of course, more fluoroquinolone antibiotics, because it just compounds on the issue, but also any other antibiotic. So here I am, over 2 weeks dealing with a sinus infection, not knowing what I'm going to do, right? So this video is to be continued. I have tried a lot of things. I've put a lot of things up my nose, and it's been a struggle. So I can't, if I take another antibiotic, and I have been taking Advil, again, I'll make this a to be continued video. There are times where I have to take Advil for pain. There's nothing else that's going to help me for my pain, but Advil. So where does that leave me, right? I don't want to compound on the issue by adding another antibiotic on top of that. Also, given the fact that I've already done 3 rounds for the sinus infection, and the sinus infection keeps coming back. So I'm going to leave you guys with that. This will be a to be continued. I will come back hopefully with another video. I'm trying to be more regular with uploads. I probably will average maybe 2 a month. And I do want to just research my videos a lot better, and that way I can give you guys some quality content, because I think some of these topics, now that I'm going through all of this, I'm discovering a lot of information that I really wish I had known before, and that I wish was more talked about on the internet. And I'm hoping that me suffering and going through these things can help someone else out there, especially with that infection that I had. That I don't see a lot of information out there about this infection. So I'll come back with a video more specific to that. But yeah, this is a to be continued, and I'll give you guys another update on the sinus infection. All right, guys, take care.